Hello, everybody. Welcome back to the Autism Hong Kong and HK Education Consultant Limited English YouTube channel. Today is 11th December 2025, and today's topic is Friday Hong Kong series number 2, the health programs and Chinese medical service for ethnic minorities in Hong Kong. We are welcome Freddie and his partner, Daniel. Hello.
Hello,
Hello.
Francis.
Yeah. But before we start our tonight's program, I would like to suggest we have mourning for victims of fires at Wang Fu Court in Tai Po, Hong Kong on 26 November 2025 for 5 seconds. Okay, now I turn the time and the channel for Freddie and Daniel.
Okay, thank you, Francis. So, I remember last episode we have talked about a general introduction for our Freddie Home Ethnic Minority Service. I am Freddie, and this is my partner, Daniel.
Nice to meet you all.
How long have you been volunteering in our service?
It's almost 2 years.
Almost 2 years.
Yes.
And I believe that the most service you have participated and helped should be the Chinese medical service. And today we are going to talk about not only the Chinese medical service for ethnic minorities, and also in a broader sense, some healthcare programs we have organized it for our EM community. But first of all, we would like to introduce our Chinese medical service, which is one of the core major healthcare service for our EM community. And I believe that you have very deep impression in this service. Can you share with us?
Okay, so basically, let me share a simple rundown of each time of the service. Basically, every time we will meet different kind of the clients or some patients from the non-Chinese community, and some of them they are follow-up cases. So I will meet them again and again, and it's very happy that to have a very fruitful casual chatting with them while they are waiting for the appointment or the service. And during the service, and then I can try to explain to them what I should remind them, like taking the medicines or some procedures afterwards. And I think it helps me to have a better communication with them. I learn a lot from this service as well.
Maybe you may not know how this kind of Chinese medical service have been begin and originated from what kind of ideas, because that was 3.5 years before, much earlier than when you join our volunteering. In 2022, I remember around April or May, the organizer of this Chinese medical clinic approached me to invite me to start collaboration with him to offer the free medical service, Chinese medical service for our ethnic minority community. At that time, I was very surprised, and I asked him whether non-Chinese will accept this kind of Chinese medical method. Will they really participate in such program? And the practitioner, the Chinese medical practitioner, who's called GEC, he said, let's try first. If there is no one participating or no one registering, then we cancel it. And it turned out that after we have sent out the registration form, it is fully registered within an hour. At that time, they offer around 20 vacancy for that session. And we found that this kind of Chinese medical service program is very popular in our EM society. And Of course, from that time, 2000 summer in 2022 until now, we have already organized almost 100, I think, more than 100,
More than
100 sessions, and we have taken in hundreds of patients. Is I guess is already over 700 patients, and during those sessions, of course, I had. For my curiosity, I asked our South Asian patients, why would you like to, and why will you be interested in trying the Chinese medical service? Do you know why, Daniel?
I'm not sure, because maybe they think that it's quite similar as their culture. Like they also will use some plants for some medicine in some sort of aspect.
Yeah, that's true. Because in traditional medical in India or in Pakistan, like what we have heard of called Ayurveda, they are using, or they were using natural methods for thousands of years, including herbal medicine, like what we use in Chinese medical service, and they believe that. Or many people, South Asians, believe that the natural and the herbal method is better, or is good for the body than the Western medicine who use chemicals. So they share with us very frequently that they actually accept the concept and the method of Chinese medical service very much. And that's why they would like to try the herbal medicine and acupuncture and also cupping. Many of them, when they come, they are willing to try acupuncture. Even I'm afraid of
the needle.
the needles.
It's
I'm
painful,
very
right?
afraid of the needles. I never try acupuncture, but they are very brave.
Same as me.
Yeah,
I
of
never
course,
tried.
the first time they have some hesitation, but when they are waiting for the medical session, those who have tried acupuncture before, they persuade, they share the experience to other new patients, new cases, and they told them that acupuncture is not that scary. So many of them asked for the acupuncture and the cupping. This is what we do in the Chinese medical service. So till now, we are still organizing it monthly, once a month, and every session we take up to 15 patients. Of course, some of the patients are follow-up case. They have been participating in our Chinese medical service for months, and they find it very useful and helpful to their health. So they participate and they registered every time. But around half of the cases each session are new cases. That means our service users are actually spreading their positive experience to their friends, and they also send the information of this kind of medical service to their friends, so that more people from our EM society can benefit from it.
That's
These
true.
are also some. We have this kind of service have been interviewed and recorded by the RTHK Hong Kong program, and this is the in charge of that clinic, GEC. And we also have some. These are the pictures of inside the clinic when we take up the cases in the Chinese medical service session. We usually have two medical practitioners at the same time, so each time they can take two cases at the same time. And this is the exterior of the clinic, and we also have many volunteers participating in each medical session, including our volunteers. For example, Daniel, we volunteer to facilitate communication between the patient and the Chinese medical practitioner, because most of them are not taking non-Chinese cases every day. Maybe the only day they communicate with non-Chinese is the day we offer to the EM service, EM community, and so they may not 100% understand what our service user and non-Chinese patients express. So we may do some facilitation or interpretation, and also we because the clinic is located in 深水埗, it's not actually not 深水埗, in 大角咀, so it is
in between.
Yeah, it's in between some different 深水埗 and the Prince Edward MTR station. So it is not a very easy location for our service users to reach. So our volunteers may guide them, or even bring them from the MTR station to the clinic, and provide them with some clear directions. But not only volunteers from our side, there are also volunteers from the clinic, especially who are the students of Chinese medicine. They have volunteers participating in observing how the Chinese medical practitioner do the diagnosis, and how they
To the cupping, some
technical acupuncture or the cupping
treatment.
So they can learn from the process, and to facilitate them in the future to become a professional medical practitioner. So this is cupping. What you want to share?
Yeah, and the meanwhile, I think this service is also a good chance for the Chinese medicine practitioner to understand the current South Asian people's situations. Like when they are asking, or during their conversations or dialogue, they will get to know more about their eating habits or their current body conditions, and then try to know more about them, and then keep having follow-up or providing the very promptly and very useful suggestions for them.
That is very important. And this kind of service, not only the consultation is free, they also, of course, the cupping and acupuncture are free, and also the medicine are free. Of course, nowadays we don't have the big pots to boil the herbs at home. So this clinic is offering free medicine in the form of powder. So our patients can pour hot water or warm water to mix the herbal powder, and they can drink it easily. And it is very useful and handy, easy to use. It's reflected by our patients. So this is acupuncture. Some of them say that is a little bit painful, but they are still willing to try, and those who have tried are willing to try it every time.
Yes, and it's true. For the time being, it's very happy to hear from them is that they can feel that the body is keeping changing good and improving. Yeah, that is very happy to hear that actually.
Yes. So this is the major health program we are organizing regularly for 3.5 years already. But besides the Chinese medical service, we also have different kind of health care program, such as this is colorectal cancer medical health talk and medical checkup organized by us, and together with the Young Memorial Social Service. And it was organized, I remember it is 2023 in October. And the service provider from the Young Memorial Modest Social Service not only provide the health talk, they also provide opportunity for the participant to take sample to the laboratory for testing. Yeah, so testing the risk of colorectal cancer, because colorectal cancer is the second common most common disease, or not disease, but second most common cancer in Hong Kong. So it's quite worrying. The government have also provides such free testing for the people above 50 years old. 大腸癌篩查 the testing for colorectal cancer. But this program includes also people about 40 years old. So it can implement the early intervention. What is the use for early intervention? Because to increase the opportunity of curing the cancer. So it will increase the survival rate. And besides this, we also have different kind of other health program. This is about
the food,
nutrition,
nutrition related
recipe.
workshops. To share with the South Asian community what we should take or what we should intake to have a better, good health. Like well balanced diet, something like that.
Yeah, because this healthy diet or balanced diet will be a good way to prevent disease. It's including diabetes, which is a very common disease in city people.
True.
City life. We have more junk food,
more
and
sugar,
more calories, but less exercise in the city. And unlike the village lifestyle, maybe a lot of our South Asian community, their ancestor, their parents or grandparents, they live in village and they have a lot of exercise, including some labor to use up the calories. So they eat a lot of starch or carbohydrates. But moving to a city like Hong Kong, they have less chance to do exercise and less chance to consume the calories. So maintaining a balanced diet or maybe less sugar, less carbohydrates may be good for their health and to prevent different kinds of disease.
True.
So this is a very recent program which is organized in this year. Is what program is this?
It is like the
osteoporosis.
Yeah.
Osteoporosis means 骨質疏鬆. That is there are pores in our bones, and
checking the density of the bone.
So this osteoporosis is not the checking. The program is checking the density of the bone. Osteoporosis may lead to different kind of problems, like easy for bone fractures. When we have osteoporosis, and so like it happens very frequently in the elderly people, when they fell on the floor, it's easier for them to get a fracture. And
especially for the women groups.
Yes.
When they are getting older and they may become the risky
they
groups,
have higher risk of having
suffering from
osteoporosis.
this.
And bone fracture is very troublesome because it takes a long time to get recovery. It's up to 6 months or more. So this is a program organized by us, collaborated with Hong Kong Red Cross. It is organized in the Red Cross headquarters, and they of course have given a health talk about osteoporosis, how to prevent it, what kind of diets can prevent osteoporosis, and after the health talk, they offer a general checkup for the bone density. So this
following by the nurse consultation.
They also have a nurse consultation, right?
True.
Because after if you just check the bone density without any further advice by professionals, that is no use. But this is the health talk about osteoporosis, talking about bone density, and we also have organized, I think 2 years ago, a eye check for EM kids, because I guess in Hong Kong it's very common for kids to have eye problem, including short-sighted, and because nowadays our kids are depending more on telephone or mobile phones and
electronic
iPads.
devices.
Yes, even at school they're using electronic books, some of them, and it may be harmful for the eye. So we have organized it with the CUHK Department of Ophthalmology and the Visual Sciences to organize a eye check program for the EM children, and we have couple of kids. I think around 30 kids got their eye check in the eye hospital in Kowloon. So this is another health program organized with together with the Hong Kong School of Nursing in 2023 for the diabetes prevention. In this program, we have some, of course, health talk about delivering some information about how to prevent or how can we identify the risk of diabetes, and also they have nurses here to help our participants to identify the risk of having diabetes. Okay, we come back to the to feel the pulse in the Chinese medical service. So we besides giving medicine in the Chinese medical service, we also help different NGOs to reach to our EM community. That is the byproduct or the something we didn't expect to get at the very beginning of starting this Chinese medical service, because every time when our patients is waiting for the medical session, they are sitting outside the clinic, and there's plenty of time for them to understand more about the mainstream social service in Hong Kong. So sometimes we invite different NGOs like Donghua Group of Hospital or Caritas. They come to introduce their service to our. Of course, they need to bring the English pamphlets instead of Chinese pamphlets to introduce their service to our service users, so they can get more information about what kind of resources they can reach in the society. So this kind of health program, we believe that's not only contributing to the healthcare of our non-Chinese community, it also can facilitate them to access to different kind of social service. So maybe this is almost all we have to share in this session, and we would like to pass the time back to Francis, and thank you for inviting us to introduce our healthcare service.
Thank you, Francis.
Yeah, thanks very much for Freddie and Daniel to share with us the medical services and the health care program for the ethnic minorities in Hong Kong.
Thank you, Francis.
Thank you, Francis.
Yeah. Before the end of our program, if you like our YouTube channel, you are welcome to like, share, and comment so that more people will have access to the program and to have a better understanding on our ethical minorities communities in Hong Kong. So thank you for watching, and see you next time. Okay, bye-bye.
Goodbye, everyone.